Hey, future cardiologists. My name is Krishna. I'm one of the first year fellows at Scott and White. Um, Hope your interview season is going well. I'm originally from Fort Worth and I went to residency at UT Houston. That's where I did my medicine residency. My time here has been awesome. I've met a lot of really great people. They really treat you like family here, and that's one of the big things that drew me to this program, and that's one of the reasons why I wanted to come here. Um, Everybody here is really, really nice and really just treat you like their own. And there's always help when you need it. And I'm pretty sure Dr. Childs will tell you about this, but one of the important things for me was the focus on education. All the fellows and staff here really value education and really just want to see you learn. And as a fellow, you get a lot of opportunities to teach as well. But the board pass rate here, I think like last 4 or 5 years at least was 100%, and the Echo board pass is greater than 90%. And Dr. Childs will tell you more about that. But there's a very, very important focus on education, which I think is really important to be a really strong clinical cardiologist. And that's one of my goals, is to be a really good clinical cardiologist, and do the best I can for my patients and learn as much as I can. And so, my time here has been really fun. I just did a rotation at the VA where you do consults for a week and then echo for a week, and you kind of rotate that for a month. It's been really fun. You get to really work closely with the staff here as well as residents here too. You get opportunities to teach the residents. You get to go in the ICU and teach them, get like a 30-minute lecture whenever you're on consults. And then you get residents who you work with, that you get give them lectures as well. And then when you're on echo, you work really closely with the staff. You pretty much sit right next to them, and you're kind of just looking at echoes. You're just kind of going systematically and kind of looking at the different pathologies and reading together. And it's a really great learning experience. And so far, my time here, every day I'm learning something new and something different, and it's been really fun. And I hope you guys decide to come here and become a part of our family. And this has really been a great opportunity for me. And so, if you have any questions, please let me know.
My name is Jordan Potter. I'm one of the first year cardiology fellows. I'm originally from the Dallas-Fort Worth area. I went to TCOM for medical school, and I actually trained here at Temple II for internal medicine. I decided to come here for fellowship because, first of all, I really like the people, but almost more importantly, I really like the attendings and the staff. And the attendings here are, they're very hands-on with you. When you're in the cath lab, they're gonna show you exactly what to do. They're gonna actually let you have the opportunity to do that yourself. If you learn by doing, then you'll really benefit from that. And just overall, I just really like the feel of this program.
Great.
That was a lot of rambling.
Well, I was going to show you my rambling video before, but one thing I might include, Jordan. Tell me, how long have you spent in the cath lab?
2 weeks.
Okay, so 2 weeks in the cath lab.
Yeah.
Do you know how many procedures you did in the 2 weeks?
I've done like 35 probably, and
Okay.
that's only because of COVID. We don't have more.
Yeah. Okay. Thank you.
So my name is Jonathan Oranzik. I'm one of the second-year cardiology fellows. I primarily came to Scott and White because I'm from a small town, Abilene, Texas, and I like kind of the small town feel. I went to medical school in Fort Worth, spent some time in the hospitals in Fort Worth and Dallas, and it felt very crowded and kind of a less personal approach that the students and fellows and residents have with their staff. But here in Temple, it feels kind of more like a smaller knit community where the staff actually have kind of more dedicated time to spend with the fellows and the residents. So that's kind of one of the things that drove me here.
Great. And you're on the ICU service right now?
I am. I'm on the cardiovascular ICU service.
Yeah, tell me about
ICU
that.
service is one of my favorite rotations, despite the fact that it's very taxing. It's kind of an exhausting rotation, but it's certainly one of my favorites.
It's that way for me too. I love it, and I'm always ready to be off when
Exactly.
I'm off and get a little bit of rest. And I think so. Yesterday was a little bit of an outlier day, but tell me about your day. Yesterday, again, and some of this relates to just being in a smaller city here. So tell me about your day yesterday.
So yesterday started off with kind of EKG teaching with Dr. Giebel at around 8:30ish, around 9. We got a phone call from the ER about someone with severe chest pain and reportedly not injury pattern on ECG. They were concerned about how severe the chest pain was. It turned out being a posterior STEMI. That's kind of what started our day, followed by 2 additional STEMIs soon to come after that, as well as a tamponade, and then also rounding on our 8 patients that we had that were already upstairs. So quite a busy day yesterday, made for a long day, but a lot of satisfying things, especially appropriate treatment of 3 STEMIs and a tamponade. So very reassuring.
Good. So it doesn't sound like things are too slow being in a smaller city.
Exactly.
Okay.
Yes.
Perfect.
You don't have one of the other things is you don't have other bigger hospitals in the community that are competing for, tertiary care patients. So anything around the area of Belton, Temple Belton, Salado, Harker Heights, Killeen, all critical things have to kind of filter through to us, so we get to see very high acuity stuff.
So we really have a draw area from at least our county, if not surrounding counties. So unlike being in a big city where there's 15 places that do primary PCI, we're mostly it for around here. Yeah.
That's right.
Okay. Awesome. Thank you.